Welcome to the deep dive. This time we're taking a look at New York State's Medicaid behavioral health system.
Oh yeah.
And specifically how it's being reshaped by this wave of managed care that's kind of sweeping across the country.
Right.
So the sources we're looking at for this deep dive focus on these new regional planning consortiums. Mm-hmm. RPCs for short.
Yeah, RPCs.
They're designed to be these sort of local watchdogs made up of providers and patients and families, and even the people who are actually running these managed care programs.
Yeah.
So we're going to try to understand if they can actually strike a balance between this promise of, efficient, cost-effective care,
right,
and the needs of some of the most vulnerable people in the community.
Yeah, it's a tough one for sure.
Yeah.
You've got this massive system overhaul happening, right? Fueled by this $8 billion grant aimed at reducing those expensive hospital stays, which is a noble goal, of course, but the changes are pretty dramatic.
Yeah, it's not just like tweaking a few things here and there.
No.
It's like a fundamental shift in power dynamics.
Yeah.
The state's pushing for privatization, so they're handing over a lot of control to private insurance companies.
Right.
Plus, a lot of the decision-making is moving away from local communities and up to the state level.
Exactly. And that's really what sparked the creation of these RPCs.
Okay.
Concerned about losing that local control and accountability.
Right.
County officials basically said, hold on, we need a way to make sure that the needs of people with mental health and substance use issues don't get lost in all of this.
Yeah, that makes sense if you're used to having a direct hand in providing these services.
Yeah.
Seeing control shift to for-profit companies and these kind of distant state agencies, it's got to be unsettling.
It is. It is. And it raises a crucial question.
What's that?
Can a system that's designed for profit truly prioritize the complex needs of individuals in recovery? And then who holds these companies accountable when things go wrong?
Right.
That's really the heart of what these RPCs are trying to figure out.
So they're like a safeguard built into a system that some people weren't even sure they wanted in the first place.
Yeah.
It's kind of like a canary in a coal mine, as we've heard them called.
Right.
But how exactly do they work?
Yeah.
Are they just sounding alarms, or can they actually do something about the problems they find?
So it's actually a two-pronged approach.
Okay.
They're like local problem-solving teams with a direct line to the state.
Okay.
So they're meant to tackle issues on the ground, but also to flag concerns that need attention from higher up.
So if an RPC sees that wait times for mental health services are like skyrocketing in their area,
right,
they can try to find solutions locally.
Yeah.
But if they realize it's a systemic issue tied to how the managed care company is allocating resources, they can raise that flag to the state.
Yep. And that's where that canary metaphor gets interesting.
Yeah.
Are they flagging issues with access to care? Are they pushing back against policies that prioritize cost cutting over individual needs?
Right.
These are the signals we need to be watching for to figure out if they're having an impact or not.
It's fascinating, right? This real-time experiment in collaborative governance.
Yeah.
But even with the best intentions, I can't help but wonder if there's a risk of them becoming a bit,
What do you mean?
Toothless. Just a way to create the appearance of community involvement without giving them real teeth.
Yeah, that's a concern that some experts have raised.
Okay.
I mean, after all, they are advisory boards, so they can make recommendations.
Yeah.
But ultimately, they can't force those managed care companies to actually change their practices.
And there's also that worry that this focus on local solutions might obscure the bigger picture.
Right.
If an RPC manages to fix a problem in their own little corner of the state, it might mask the fact that the system itself is flawed.
It's like putting a Band-Aid on a broken leg.
Exactly.
It might provide temporary relief, but it doesn't address that underlying fracture.
Right, and that brings us back to this fundamental tension between privatization and the public good.
Yeah, a question that goes way beyond just behavioral health care.
Right.
As more and more public services get handed over to private companies, we need to ask ourselves, how do we make sure those companies are accountable to the communities they serve?
Yeah.
And are these collaborative models like RPCs actually enough to safeguard the interests of those who need it most?
These are tough questions. And as we mentioned, it's still early days for the RPC model.
Right.
So to get a better sense of how this is all playing out, let's delve into what the research actually reveals about the experiences of those involved.
Absolutely. Let's hear what those on the front lines have to say. One of the most striking things from the research is just how much the folks behind these RPCs believe this can work. They really think that this collaborative approach is the way to go.
That's encouraging. I mean, it makes sense, right?
Yeah.
They poured their hearts and souls into designing this whole model. Mm-hmm. So, of course, they want to see it succeed.
Right.
Did anyone express any doubts, though?
Some did, especially those county officials who were really close to the system before the overhaul.
Okay.
They liked the idea of the RPCs,
yeah,
but they were worried about how much influence they'd really have, particularly when it comes to those high-need individuals who often fall through the cracks.
Right, the folks who might not have the loudest voices,
exactly,
but who need the most support.
Yeah, and remember, the RPCs, they don't control the money.
Right.
They can't force the managed care companies to do anything.
So while they might be able to raise awareness about a problem and come up with solutions,
right,
ultimately, it's up to the managed care companies to implement those changes.
Yeah.
And, those companies, their bottom line is profit.
That's the crux of it. Yeah.
And some officials even worried that the RPCs could end up masking the negative impacts of privatization.
Oh, so?
Well, if an RPC manages to fix a problem that's really localized, it might create this illusion that everything is running smoothly.
Okay.
But that one success story might not reflect the broader struggles that people are facing across the state.
So it's possible that they could become like a PR tool for the state.
Yeah.
A way to say, look, we're listening to communities, everything's fine, when in reality the underlying issues haven't been addressed.
Exactly. But it's important to note that most of the people interviewed, despite these reservations, still felt the RPCs were the best option in a difficult situation.
It's like they're trying to make the best of a system they didn't necessarily choose, trying to inject some community control and accountability into a structure that, frankly, some people see as fundamentally flawed.
And it's also crucial to remember that this research was done before the RPCs were even fully up and running.
Right. So we're still in the observation phase.
It's like a live experiment unfolding before our eyes.
Yeah.
And the result could have implications not just for New York,
right,
but for the future of behavioral health care across the country.
Absolutely. Think about it. As of a few years ago, there were 55 approved Medicaid waivers across 43 states.
Okay.
And even more pending approval.
So this move towards managed care and privatization, it's happening everywhere.
It is.
Which means these questions about collaborative governance and balancing efficiency with democratic values, they're only going to become more and more pressing if RPCs can't effectively hold these private companies accountable.
Yeah.
What does that mean for the future of community-driven healthcare?
It's a question worth thinking about, and it's why the researchers' emphasis on this principled engagement is so interesting.
Okay, break that down for us.
Yeah.
What exactly does that mean?
It's about creating a space where all these different perspectives can be heard, and where decisions are made through consensus, not coercion.
Okay.
It's about prioritizing the voices of those who are often marginalized, people with lived experience, small community organizations, folks in rural areas who often get overlooked.
Because, let's be honest, they're the ones who truly understand what supports are needed.
Exactly. Their expertise is essential if we want these RPCs to be anything more than just window dressing.
This reminds me of something a family member of mine who navigates the mental health system once told me.
Oh, yeah.
They said, it's not about fixing me. It's about supporting me to build a life I find meaningful.
Right.
And it seems like that's what a recovery-oriented approach to behavioral health is all about.
You hit the nail on the head. It's about empowering individuals, not just managing their symptoms, and providing support that takes into account a person's strengths and needs.
So how do the RPCs fit into this recovery-oriented philosophy?
Well, the researchers argue that by giving a platform to those with lived experience, the RPCs can help ensure policies and programs are aligned with the real needs of the community.
So it's about shifting the focus from top-down directives to ground-up solutions.
Precisely. And that's why this deep dive is so important. It's not just about understanding the mechanics of these RPCs. It's about grappling with these fundamental questions about the future of behavioral health care.
Yeah, if we truly want a system that supports recovery and well-being, are collaborative models like RPCs enough?
Right.
Can we reconcile the profit-driven nature of managed care with the complex human needs of individuals in recovery? I mean, these are questions we're going to be asking for a long time.
Yeah, definitely.
But let's bring it back to our listener for a second.
Okay.
What does all this actually mean for them? You know, for someone who's trying to make sense of all this change in behavioral health care?
I think the first thing is just to be aware. You know, this shift towards managed care and privatization,
right?
It's happening.
It is.
And it's impacting how services are delivered, who's making the decisions,
right?
Even how we define recovery.
It's easy to feel powerless, you know, when these big system changes are happening. So is there anything that individuals can do to make their voices heard?
Absolutely.
Okay.
Remember that concept of principled engagement we talked about?
Yeah.
That's not just for policymakers. It's a philosophy we can all apply in our own lives.
So instead of just complaining about the problems, we should be actively looking for solutions.
Right.
Listening to different perspectives and working together to create change.
Exactly. Imagine like a community meeting where people are sharing their stories, not just their demands.
Right.
That's principled engagement in action.
Yeah.
And it can really shift the whole conversation.
It's about recognizing that we all have a stake in this.
We do.
A strong behavioral healthcare system benefits everyone.
Yeah.
Not just the people who use it directly.
I agree.
And the more we understand how these systems work, the better equipped we are to advocate for ourselves and our loved ones in our communities.
That's a great point.
So to wrap up this deep dive,
okay,
what's the one thing you want our listener to walk away with today?
I'd say don't underestimate the power of your own voice. The future of behavioral health care is being shaped right now.
Yeah.
And it's going to take all of us working together to make sure it's a future where recovery and well-being are truly prioritized.
I like that. So remember, even small acts of engagement can have a ripple effect.
Absolutely.
Sharing your story, attending a community meeting, writing to your elected officials, these things matter.
They do, because at the end of the day, a system that's designed for recovery is a system that's designed for all of us.
That's a great thought to end on. Thanks for joining us on this deep dive.
My pleasure.
Until next time, keep learning, keep questioning, and keep the conversation going.